In this video, we're going to talk about rubella. Rubella is an infectious disease that can cause symptoms such as fever, rash, mild eye inflammation, and swollen lymph nodes. In extreme situations, a patient can develop brain or joint inflammation. There is currently no medication for the virus, which means the only method of treatment is a vaccination. These symptoms occur 2 to 3 weeks after the infection of the virus. The main method of virus transmission is by infected droplets of fluid that patients with rubella breathe out, sneeze, or cough. Children and young adults have the greatest risk of being infected by the virus. The R0 of rubella is 8. This means that one patient can infect up to 8 other people. The virus can pass the placenta. This means that the fetus can be infected. When this happens, serious complications for the fetus can occur, which is called congenital rubella syndrome. Other major complications that can happen are miscarriage and death. The infection has to take place in the early stages of the pregnancy for this to happen. The earlier the infection takes place, the more severe the case becomes. Before the introduction of the vaccine, up to 4 babies in every 1,000 live births were born with congenital rubella syndrome. Vaccination of rubella is done with 3 different types of vaccines: a monovalent form, a bivalent form, and a trivalent form. These different types are made out of live attuned rubella virus. Commonly used rubella vaccine combinations are with measles, measles and mumps, or measles, mumps, and varicella. A vaccination against rubella in the Netherlands usually takes place at 14 months old until 9 years old. This vaccine is given later than some other childhood vaccines because antibodies transferred from the mother to the baby can provide some protection from the disease and make the MMR vaccine less effective until about 1 year old. After 2 vaccinations of the MMR vaccine, 99% of children are protected against rubella, measles, and mumps.